evening, everyone. Today, we have all gathered here in order to discuss a few things about hypertension, which is one of the most common presentation nowadays in the young adults as well as elderly people. Previously, we used to come across cases in elderly or age group more than 50 patient presenting with hypertension. But nowadays, we have patients coming to us with an early onset hypertension, which is probably we are coming across people in the late 20s or early 30s who are coming with hypertension, high blood pressure. So today's discussion and focus will be basically on understanding the detail about the hypertension, what the causes, what would be the prevention, and what would be the treatment aspects, and how can we actually adapt our lifestyle and what would be the changes. And basically discussing about the hypertension, what is actually meant by hypertension. So basically, everyone would like to have a healthy and normal blood pressure. But what exactly does it mean? What does normal blood pressure generally means? Basically, each time when the heart beats, it pumps blood into the blood vessels. What happens when it pumps blood into the blood vessels? This itself creates a pressure against the wall of the blood vessels. This is called as blood pressure. So basically, when you pumping blood into the blood vessels, which is pressure is created, this pressure is basically called as blood pressure. Normally, in healthy blood pressure, it rises and falls throughout the day. We have a misconception that all the time, the people have a misconception all the time the blood pressure is constant 120, 80. It's fixed in the person's thoughts that BP should be constantly 120, but it's not so. It varies, and it varies with the time and day, like it's rises and falls throughout the day. But the blood pressure remains high or for a longer duration and left untreated, it can lead to serious health complications. We have patients coming to us in our OPD who are hesitant to start a treatment of hypertension. Many of the people, they are diagnosed with hypertension, clear-cut hypertension, but they are resistant in starting the treatment. Why? Why is that so? Because basically they think if they start a hypertension tablet early in their lifespan, they might get it through or they might have to continue it lifelong. But that is not the question. The question for us is maintaining the normal blood pressure throughout our life, because if we have an elevated blood pressure over a period of time, this itself can lead to complications, most commonly being the left ventricular hypertrophy. And that has to be avoided. Once that sets in, it's difficult to reverse it. So we have to explain our population that taking a drug is not a problem, but if the BP is elevated for a longer duration, and for a longer period of time, that can lead to complications. So I'll always tell my patients, taking a tablet is not an issue. But if you keep your blood pressure on a higher limits for a longer duration of time, that itself is a very, very hazardous risk for you. So high blood pressure usually develops over a period of time. It doesn't generally start overnight or over a period of time. It can happen because of unhealthy lifestyle choices. We are nowadays in an era where probably almost all the things which we take are not like fresh or what we can expect naturally processed. We are coming across many adulterations in our foods, in our daily things what we are having. We are used to taking junk foods. We are used to taking unhealthy diets. For example, not having enough physical activity. Obesity. Obesity is like the most common issue, burning topic nowadays, which is seen in the young adults or elderlies. And apart from this, we have added risk factors of alcohol consumption, smoking, and stress, or any zarda or any other aspects of tobacco. So tobacco and alcohol are the major health risks for all our populations. So these are the major hazardous risks. So what happens when the patient has such lifestyle over a period of time? They have a high risk for hypertension. They have a high risk for hypertension. Some of the other risk factors what we have encountered is age. Age is one of the important things. As the patient gets old, what happens is as the people get older, the arteries can stiffen up. The arteries can stiffen up and narrow as excess fat builds up. Family history of high blood pressure. One or more, the most important thing when we come across people is, what do we generally have to do? We have to ask, do you have a family history of high blood pressure? Because nowadays we are coming across many cases who are having unexplained cardiac deaths, who are dying in the early 30s. So these patients, the most important thing is when the patient is diagnosed with hypertension, the first thing we should ask them is, do you have a family history of high blood pressure and a history of coronary artery disease? or any 1 or 4 family history which is there, you have a risk of developing it in the next generations. Or any patient of premature cardiac death, it can run in their families and it can be passed on to the further generation. That is the reason people with premature cardiac deaths have to get yourself evaluated and have to get yourself treated as early as possible. Next important thing is excess salt intake. Excess salt intake is also known to raise blood pressure. The 4 whites which are there in our day-to-day life, it's not good for our health. So what you say, namak, the salt, sugar, maida, all these things are not good for our health. So we have to restrict these things in our diet for proper control of blood pressure, diabetes, and any other aspects. And why is that potassium-rich diets are beneficial for you? So we should encourage our patients to have a potassium-rich diets. And potassium, not having enough foods with high potassium can increase the blood pressure, increase risk of stroke and chronic kidney disease. The problem why the incidence of kidney failures and chronic kidney diseases is developing is because of uncontrolled blood pressure. Uncontrolled blood pressure is leading to chronic kidney disease. Eating processed and fatty foods increase fat throughout the body and make the heart work harder to push blood throughout the blood body, hence causing blood pressure to rise. On the other hand, lack of physical activity leads to obesity and further high blood pressure. How much physical activity is indicated per day? Actually, there are guidelines which recommend 150 minutes of physical activity per week. So actually, if we divide it per day, 20 to 25 minutes walking per day is recommended. And actually, if the patient wants to take an off, they can take an off one day, 6 days a week. See, 25 minutes per walking per week, per day is more than enough for the patient. You don't need to tell the patient to walk 1 hour per day or exercise. Heavy exercise is not recommended. Eating processed foods, any processed foods is very, very bad for health. It's a big no for the patients. Eating achar, eating papad, all these things, eating fried items, it's a big no to our patients. Kindly tell our patients and kindly tell your family members to avoid taking the processed and fatty foods. The processed foods are land ourselves in high risk for increased risk for hypertension. What do they basically do? They make the heart work harder to push the blood throughout the body, hence causing blood pressure to rise. On the other hand, lack of physical activities links to high obesity. Another one is stress, which I think every person might be experiencing in the lifetime nowadays. It's very difficult to tell someone to avoid stress, but that is one thing which has to be followed. Even if you follow all these things, if you don't avoid stress, you are probably landing yourself into hypertension too early. So the most important thing is avoiding stress. So for this, the proper guidance and the proper handling of the probably all the things is very essential. So that is the reason hypertension is called the silent killer. It puts people at risk for several diseases from cardiovascular problems to kidney failure, strokes, and even eye damage and blindness. Hypertension itself can cause hypertensive retinopathy, which can cause blindness. In heart, it can cause MIs, cardiovascular risk, coronary artery disease, and for the neurological aspect, it can cause strokes. And hence, early and accurate diagnosis is very important management of hypertension. Measuring the BP is the only way to know whether the patient has high blood pressure or not. Generally, when symptoms do occur, they include morning headaches, occipital headaches or tiredness, vision changes, blurring of vision, buzzing in the eyes, fatigue, nausea, vomiting. If any one of you experiences these symptoms, they should get your blood pressure checked. Fortunately, high blood pressure can be diagnosed. Usually measured with an instrument, what you can say is sphygmomanometer. It has 2 readings, systolic and diastolic BP. Healthy or normal blood pressure should be or lower than 120/80. Hence, the upper limit indicates systolic blood pressure, which means blood pressure in the blood vessels when the heart contracts, whereas the lower number diastolic indicates means the pressure when the pressure in the blood vessels when the heart rests between the beats. So basically, the systolic is the blood pressure is the blood pressure when the heart contracts, and this is when the heart rests between the beat. So if the BP is more than 140 and 90, then the person have hypertension. If the BP level is higher than this, then he or she might develop serious heart diseases. Basically, May 17 is celebrated as World Hypertension Day, a day dedicated to highlighting the importance of monitoring BP. So it is an astonishing number, 1 billion people. We have to give awareness for this hypertension. The risk, how can we prevent this hypertension risk? They are by regular exercise, as we have discussed, 20-25 minutes walking per day. Healthy diet improves fresh fruits and fresh leafy vegetables. Quitting smoking and alcohol intake. The most important part of this is quitting the addictions. Regular BP monitoring, stress management, and adherence to medicines if required. Regular exercise, physical exercise, it's required. It's a drug-free approach. If the patient is having a slightly higher blood pressure compared to the normal, can advise basically exercise or physical activity. It might be astonishing, but even a 10 mm reduction in systolic BP might reduce the incidence of cardiovascular disease and strokes by 20%. So even a 10 mm systolic BP reduction for our patients might be helpful in preventing the future cardiac and coronary events, and stroke events and neurological events. So this is the important, even reducing even 10 systolic blood pressure. So regular exercise helps to maintain a good weight. Aim should be at least 30 minutes, 25 minutes. Their jogging is good. Whereas this walking is good and swimming is good. Don't go with the excessive, aggressive exercises. Healthy diet, as we say, it's DASH diet. Eating less saturated fat or total fat, giving plenty of potassium, limiting amount of sodium in the diet, and avoiding alcohol consumption. Nowadays, we have pink salt coming, which is quite helpful in reducing the BP as well. What is DASH diet? It is rich in whole grains, fruits, vegetables, low fat, skims on, and saturated fat, which can lower BP by 10 mm, as we have discussed. Reduce sodium. Read food. Basically, you have to read food labels. Nowadays, every food which is coming to my market has their calories written, their ingredients written in it. So follow this and choose a low calorie diet or a low sodium alternative. Processed foods have to be limited. So only a small amount of sodium occurs naturally in foods. Most sodium is added during processing. So avoid these processed foods. Don't add small salt. Even a 1 teaspoon of salt has 2,300 milligrams of sodium. So avoid adding salt to diet. Quit smoking. Regular BP monitoring, as indicated, is very important. Stress management, which is very important, which can reduce the BP naturally. Adherence to medicines. Don't run away from the medicines. Your medicines are only going to reduce your BP and prevent the further events and going to prevent the further complications. At last, I would like to suggest that there is nothing more precious than having a fit and healthy life. Adapting healthy lifestyle can help us to enjoy a long and healthy life. High BP can be prevented as well as controlled in many ways. Keeping blood pressure in the normal range is very important in preventing cardiovascular complication. So with this, I'm Dr. Mohammed. I'm a consultant physician and associate professor in Deccan Medical College. I'm consulting physician in Faith Hospital, Yakutpura. So with this, probably we might be will be ending our talk. So we hope these things will be followed by our patients and our people in following the basic guidelines and reducing the hypertension.